Hello, welcome to Community Report on Channels Television. If this is your first time of tuning in, thank you for joining. And for our regulars, it's another episode of the program that brings to your screen stories around communities of influence, whether they be united by same location or have some uniqueness, or a virtual community co-joined by some semblance of ideology. This we do every week in an educative and informative manner. Today, our focus is on a cottage hospital set up some location around Lagos, and Ikeja to be precise. This was done some 61 years ago. That small cottage hospital has blossomed to a healthcare hub or community, delivering varying healthcare solutions in one location. This is the story of Lagos State University Teaching Hospital, LASUTH. By the way, LASUTH has just completed a successful kidney transplant. Stay with us for more on that. I'm your host, Olu Phillips. Ikeja, the capital of Lagos State, southwest Nigeria, is one of the areas that made up the defunct 5 divisions in the state, which defined the identification spread of Lagos long before it was grouped into local government areas which replaced them. Incidentally, the location has remained as well as the name. It is the capital of the state and quite unique in more ways than one. Among some of the notable structures are the government seat of power, the state assembly, business districts, and several healthcare centers, both private and public. As a close community of residents, commerce, and governance, it's a miniature Lagos. Embedded as part of the Ikeja community are several evolving communities standing and coming into their own. An example of these is a fast-growing health community now referred to as the Lagos State University Teaching Hospital, LASUTH. Often confused as LUTH, that is the teaching hospital of the University of Lagos, owned and maintained by the federal government. LASUTH is a brainchild of the state government. LASUTH is sandwiched in between other members of the larger Ikeja ecosystem or community. You have the High Court, the Police College, and Police Command, the country's 2 most busiest airports, and Africa's acclaimed biggest IT hub, nicknamed Computer Village. The confluence of health practitioners, non-clinical personnel, and people seeking for health care solutions, both primary, secondary, and tertiary, has today blown into the proportion of a community of some sort and considered in some quarters as a one-stop place for healthcare delivery.
LASUTH is a place to come because we deliver the service to whoever needs it. We sort of have a composite team of doctors, and because this is a referral, it's a tertiary institution. It's a place where you can actually have the other supporting units or other subspecialties, in terms of treatment. For instance, if you need to see, let's say you need a neurologist, a urologist, for instance, to take care of some aspects of the kidney disease. We don't have to send you to another place, so you get seen by a urologist. If you need a cardiothoracic surgeon, for instance, at times we place some vascular access, some issues with other forms of cardiac disease. Then you see the cardiothoracic surgeon here in LASUTH. We have a functional cardiology unit because many of the cases of kidney disease also have heart disease, and so there's this interplay or interaction between the subspecialty of nephrology and so many other subspecialties. So in terms of having that composite number of subspecialties that you can actually access, specialty care. LASUTH provides such an environment, and it's kind of almost a one-stop shop for your health needs. So both, you can get the primary care, secondary care of some sort, and tertiary care here in the same institution. So that provides a lot of you can actually have a lot done for you by just coming into LASUTH.
The growth trajectory is an interesting one that started as a noble idea of a simple cottage hospital some 61 years ago.
This place started in 1955 as a cottage hospital. The cottage hospital was just probably 2 or 3 buildings attending to primary health problems. At that time, the big hospital in Lagos was General Hospital Lagos. Okay? In the year 2001, the government at that time decided there was need to increase capacity for medical care around Lagos State. There was need to establish other health institutions so that you can have a better coverage for the people. So then it became a general hospital, okay? And then in 2001, the state governor decided there was need to also establish a teaching hospital. That was a big challenge because we had old structures on ground. What we are doing right in the hospital now is the 3-tier level of medical practice, which really isn't what we're supposed to do. There should be a primary health setting, there should be a secondary health setting, there should be a tertiary health setting, which is what a teaching hospital does. Ideally, we should be serving primary care. But over the years, it's going to take time, really. It's going to take time for us to now separate. And we can't totally separate primary, secondary, and tertiary. Because if you live around here and your child develops gastroenteritis, this would be the first place to come. Ideally, they should go to a primary health center. But if the child is severely dehydrated and it comes to you, you will need to resuscitate it. So, but most of the time we should be tertiary, we should be doing this cochlear transplant, we should be doing cardiac surgery, we should be doing transplant of the heart and things like that, which I hope eventually we'll be able to do. But in terms of capacity, we have about 120 consultants, we have about 120 residents, and we have about 80 house officers, okay? And then we have about 600-700 nurses. The bed capacity is about 600 now.